any questions you may have about prednisone. This is a prednisone Q&A. So drop them in the chat and I will be here to help answer your prednisone questions. I'm a board certified doctor of pharmacist and third generation pharmacist. I'm board certified in exactly the type of conditions that people take prednisone for: rheumatoid arthritis, lupus, nephritis, ITP, immune thrombocytopenia, all of these conditions that people take prednisone for. I am board certified in ambulatory care pharmacy. So that is the training I need to give you the best help possible. Plus, I attended a training at Harvard Medical School. And at that place, I learned all about some of the conditions that people take prednisone for. So if you have prednisone questions, please drop them in the chat so I can help answer them for you. I'm Dr. Megan, the prednisone pharmacist, and I would love to give you support while taking prednisone because this drug, you need answers while you're taking this medication. I personally had to take it, and even though I'm a pharmacist, I still felt like I needed answers to my questions. So drop your questions in the chat, and I would love to answer them, all about what it feels like to be on prednisone. Real quick. Blow my nose. All right. This is live. This is live, y'all. Prednisone questions. Who's got them? Who has questions about prednisone? All right. Well, until we have an actual question about prednisone, I'm just going to talk about some of the people who've reached out to me recently who take prednisone. So one of them, she's a prednisone warrior who has been taking prednisone for 30 years. She has a disease called sarcoidosis, and this has gone to her lungs, making it difficult for her to breathe. And it's really hard because there aren't many other options that help out. So she's been taking this forever to keep her healthy, and she has so many side effects. It has caused her vision to start going. It has caused her to have osteoporosis and lose height. It is so hard to be taking prednisone and have awful side effects. So if you have questions about prednisone, drop them in the chat. I'd love to help out. Get your questions answered that you may have about this amazing miracle medication that causes more side effects than any other drug. Yes, you heard that right. Prednisone causes more side effects than any other drug. All right. I hope I'm not getting the cold that my kids have. Whole house full of coughing, sneezing kids. But luckily over live, you can't catch my infectious disease if I happen to have one. So, but if you were taking prednisone, would you be at a higher risk for catching an infection like that? Potentially, because prednisone causes immunosuppression. It's typical that the types of infections a person who takes prednisone will get would be pneumonia, especially from things like the flu, which is why it's a really good idea to get your flu shot. Now's a good time, or sometime before the end of October would be a great time to get your flu shot if you are taking prednisone, because pneumonia is your number one way of dying from prednisone side effects. So I don't want that for you. Everyone go get your flu shots. Some years are better matches than others. Last year I got my flu shot and I also got the flu. So last year wasn't a very good match. And that's because they have to predict 6 months in advance what the flu is going to look like. And sometimes they guess wrong. So I'd love to hear other questions you may have about prednisone. Other infectious diseases that a person on prednisone might get include yeast or thrush, like in the mouth, having little white patches that are painful lesions. That can happen and it's miserable. Yeast can overgrow in other places too, fungal overgrowth. So prednisone can really impair your immune system. So I've talked about the flu virus. I've talked about yeasts. What about bacteria? Prednisone can also cause an increased risk for bacterial infections. specifically pneumonia. Um, and then other types of virus include if you had herpes in the past, like you had chickenpox or other types of herpes, they can reactivate because of prednisone suppressing the immune system. So in chickenpox, that means reactivating as um, miserable, painful zoster. Oh shoot, what's it called when you get that awful rash? That's so painful. Great. Well, I can't remember. Um, but those who experience it know exactly how miserable and horrible it is. So, what questions do you have about prednisone? I love to answer those for you today. All right. So, I've talked about infections you can get from prednisone. Let's talk about other questions you might have. So, what is the number one side effect of prednisone? Anyone want to guess what the number one tweeted side effect of prednisone is? Type fast, type fast. It is da 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 da. Ooh, we got one. We got somebody to guess. Okay. Well, at least a comment. So the number one tweeted side effect is insomnia, but I'd rather talk about this. So Purple Grit says, diagnosed in May with rheumatoid arthritis, RA, 71 years old, can't seem to get below 15 milligrams of prednisone without pain ramping up to a 6 to 7. Oh, I'm so sorry. RA is so painful. I have family members, ancestors who've had to deal with it, and it is prednisone is truly a complete miracle for rheumatoid arthritis. That was who they first experimented prednisone on, was people who had RA, who otherwise were completely bedridden and in dramatic pain and unable to move. And then prednisone allows a person with RA to function, but 15 milligrams is a lot if you're still having pain up to 6 to a 7. And then your guess is fatigue. Actually, fatigue is definitely one of the highest side effects, especially for long-term prednisone use. There is a survey, I don't even know how to explain it, a website called SAM, Steroids and Me, SAM, and they kind of let you put in your side effects and track them, I think. Never really used it. But I saw one of their posts saying that fatigue was their number one showing up in the survey. So it's pretty tough, the fatigue caused by prednisone. So Purple Grits, I want to know if you've tried anything else besides prednisone and what your experience has been. So other things could be for rheumatoid arthritis could be methotrexate, hydroxychloroquine, sulfasalazine, or another DMARD or disease modifying anti-rheumatic drug. Or if you tried a biologic like Humira, Enbrel, Kevzara, Actemra, lots of them that end in RA for RA, rheumatoid arthritis. So if you have any of those, any experiences you want to share with how well those did or didn't work for you, or the side effects that made it so you aren't using them anymore, or if they're just kicking in. Because if you were just diagnosed in May with RA, then maybe those other medications haven't quite kicked in as quite yet. Because if your doctor's following the rheumatoid arthritis guidelines, then getting a phone call. Oh, okay. Don't you guys all love spam? Ugh. Okay. So back to rheumatoid arthritis guidelines. If your doctor is following them, then the first drug you'd be prescribed is methotrexate, and then often in combination with prednisone to help you get the immediate relief of pain, because the methotrexate takes up to 3 months or so to kick in. And both come with their own set of horrific side effects, but prednisone's side effects are worse for most people than methotrexate side effects. So I would definitely recommend, getting another medication on board that can allow you to decrease the number of milligrams of prednisone you're on, because the number of milligrams of prednisone over your lifetime is completely correlated with your risk for side effects. Side effects like heart disease, diabetes, and bone loss leading to osteoporosis. So you want to keep the number of milligrams over your lifetime as low as possible. The guideline says to be on the lowest effective dose for you. And 15 is super high. Okay, Purple Grits, thank you for sharing more details. On methotrexate, 20 milligrams tolerated okay for 15 weeks. And then added leflunomide, could not tolerate it with severe diarrhea and stopped it. Okay, I really appreciate your doctor. Your doctor is doing exactly what your doctor should be doing, taking methotrexate. And if you've been doing it for 15 weeks, it should be starting to kick in at this point. But it sounds like you have a really tough case, a really hard hit of RA. If you're still at 15 milligrams with that much pain and methotrexate, oh, I'm so sorry. But interesting about the leflunomide that it was the diarrhea that made it so you had to stop. Yeah, that's pretty typical. So if it were me and I've already been on methotrexate this long and I've tried leflunomide, I'd say, hey, can I try Humira next, an injectable biologic? That's what I would want, because we want to do everything we can to keep your prednisone dose as low as possible. All right, we have another comment. And please, if you're here, comment below any questions you have about prednisone. Okay, Radio Nigel said, I was started on 15 milligrams of prednisone and now gradually reduced to 4 milligrams. Joint pain increasing. Is it okay to take paracetamol and ibuprofen? So for those of us in America, you might be wondering what paracetamol is. That is what they call acetaminophen in other countries. So it is usually okay to take acetaminophen, paracetamol, with prednisone. That is, for most people, completely acceptable. Definitely run that past your doctor, but that is pretty accepted, that if you have pain, you can take Tylenol, which is the brand name, or acetaminophen or paracetamol. However, ibuprofen, when taken along with prednisone, causes a drug interaction that can increase your risk for ulcers in your gut, that can lead to bleeding, that can become fatal, that can kill you. So it's rare, but it definitely happens, that the combination of the prednisone and the ibuprofen really thins the gut lining, and it can lead to fatal outcomes. So you want to avoid that combination. But if you have been decreasing and now you're having joint pain increasing, I don't know what you're taking it for. You didn't mention your diagnosis on here. But if you're taking it for joint pain, then this is a different story. But if you're taking it for anything else, that if you're taking the prednisone for any other diagnosis that is not joint pain, and you have increasing joint pain, it might be that you're experiencing prednisone withdrawal. That one of the reasons we taper off prednisone slowly over time is so that your body can accommodate itself back into normality. And one of the things that happens is your body gets used to you artificially giving prednisone to replace cortisol. Oh, you have polymyalgia. Okay, so polymyalgia, you probably have joint pain then. And for polymyalgia, acetaminophen and ibuprofen usually don't do much at all for that kind of specific kind of joint pain. And they also don't really help very much with prednisone withdrawal joint pain. So you can add as much Tylenol, well, up to 4,000 milligrams, depending on your health, up to 3,600 milligrams if you have more fragile health per day. But it may or may not help when it comes to polymyalgia joint pain. And it definitely isn't going to help the prednisone withdrawal joint pain. So what can you do if you are having joint pain or dramatic fatigue or other things while tapering off prednisone and getting getting close to 4 milligrams and like, I feel pain again. Essentially, you need to go up to the lowest effective dose that was still working for you. So if you're at 4 and you were at 5 and you didn't have the pain, then you need to stay at 5 for longer. You need to allow your body to get back to wherever it felt normal. And if that was 5 milligrams or 10 milligrams or wherever it was in there, if you have polymyalgia, I'm guessing it was 8. I could be wrong. But a lot of people with polymyalgia rheumatica or PMR get stuck somewhere between 7, 8, and 9 milligrams. And then after that, start getting the joint pain coming back, and it's awful. So if you had the prednisone withdrawal pain, then go back up to wherever that last dose was where you weren't having that joint pain and stay on it for longer. Whether that is you were tapering every week or every month, whatever it is, stay longer wherever that last dose was. All right, Barbara has a question. What is the test to check if your adrenals are working after trying to taper? I'm 74, been off and on prednisone for 30 years. Okay, now this is a super tricky question. There's a lot of factors to consider here. So the first factor to consider is after trying to taper. I'm not quite sure what you mean by that. Are you actually off of prednisone, or have you just been trying to get off of prednisone? Because if you're actually off of prednisone, then it's a different answer than if you're still on prednisone. So I'm going to answer first what the answer is if you're still actually taking prednisone and you're trying to taper, but you haven't successfully stopped. Okay. So if you're still on prednisone, there is no blood test that you can use that will definitively be accurate. None of them are really going to work while you're taking prednisone. I've heard of some doctors who will test it anyway, but it's really not an effective test. So Barbara, thank you for more clarification. Barbara says she's down to 2.5 milligrams. That really does help. So if you're at 2.5 milligrams, none of the tests are going to show anything that's worth seeing yet. You have to be off of prednisone for at least 3 weeks before the tests that I'm about to share are really reflective of anything worth knowing. Before then, it's like, oh, you have cortisol. Great, I don't care. Doesn't matter until 3 weeks after, okay? So 3 weeks after you stop your last dose of prednisone is when you can test several things. First is cortisol. Now, this is a test you could do multiple ways. You could use a saliva test, spit into a tube, and you could order that off my website. You could get a blood test of cortisol. And if you're doing the saliva test, you'd want to do it 4 times a day. If you're doing the blood test, you could do it once a day, but it would always be like the most accurate, most important time to test is first thing in the morning, like 8 a.m., 7 a.m., like as early as the lab opens, basically. Then, if that's normal, great. That's fantastic. If it's not normal, then you need to work with an endocrinologist, and they can order different types of tests to see what is going on with your HPA axis, your hypothalamic pituitary adrenal axis. And one of them is called the ACTH, so adrenocorticotropic hormone, ACTH stimulation test. So they often call it a STIM test. And they can do that in multiple ways. It depends on the lab. It depends on what the doctor likes to do. Sometimes they use glucose. Sometimes they use other things. They're all different. And there's no standard that's like black and white. This is exactly what you should do 3 weeks after stopping prednisone. So how's that for a long-winded, hey, nobody actually really knows what the answer is to this question. And if you were to ask a room full of endocrinologists, they'd all tell you a different answer. So there you go, Barbara. Basically, you're still on prednisone. There's no point in testing anything. But Peter has a question. Peter Perrick says, hi, I have PMR, gotten a 6.5. I find it impossible to sit down on anything. I'm like this for 2 years now. I've just gone up to 7. Is it okay to go up and down for a bit? Definitely, Peter. If you have PMR, you go up and down to your heart's content. I mean, work with your doctor. Everything I'm saying here, your doctor is the expert. Work with your doctor. I'm talking about this drug and general principles when it comes to prednisone and PMR. I went to a Harvard Medical School seminar all about prednisone and PMR. So I feel like I can answer this with a lot of confidence, but you should work with your doctor. And that is that when you have PMR, you go up and down while listening to the symptoms in your body. If you're finding it that the PMR that usually either affects your shoulders or your hips, I'm guessing when you say it's impossible to sit down, that it's affecting your hips, that it's flaring up again. And so you do need to raise your dose. Go up to 7 or whatever dose it takes so that you're comfortable again. You need to be able to sit. You need to be able to function in life. And so whether that's 7 or it's 10 or another number that your doctor comes up with, you work with your doctor on, that's totally normal. That is a normal PMR journey to start somewhere between 15 and 25 milligrams when you were first diagnosed, and then slowly taper over 6 months to a year. And then sometime in that first year, most people flare until you have to go back up to whatever dose you're not flaring at. That is a normal. So it's kind of like this. You start out with a higher dose and then you slowly taper over time and then you flare. So you go back up and then you hold that and then you slowly taper over time and you might flare again and you might have a really bad flare and even have to go higher. You just got to find whatever dose is going to give you the pain relief so that you can live your life. There's no reason for you to be in pain with PMR. None at all. Like, you should be getting the pain relief you need. Oh, Barbara says, thank you so much. You are so welcome, Barbara. I love doing these live videos. It is so much fun for me to talk to all of you, to hear your stories and what is going on with you, what you're concerned about when it comes to prednisone. Sounds like we've got a lot of polymyalgia people today, which is a lot of fun because I really like talking about PMR. What other questions do you have? Peter, Barbara, Nigel, anyone else? What questions do you have about prednisone, PMR, and other diseases that you have to take prednisone for? Okay, so I've talked about rheumatoid arthritis in depth, so I'm going to talk a little bit more about prednisone and PMR. So PMR, polymyalgia, I already mentioned it usually affects the shoulders or the hips, and it's this inflammation and pain around those joints, not necessarily in those joints, like the disease I talked about first, which was rheumatoid arthritis. And I'm going to drop this in the chat so people know. Ask prednisone questions in the chat. So back to PMR. PMR usually affects people who are 50 years and older of European descent. That is the most common population. Since I'm 100% of European descent, I really hope it doesn't affect me. But I have my own personal autoimmune disease I had to take prednisone for, so I understand the journey of the roller coaster of I was fine on prednisone and then my autoimmune disease flared, so I had to go back up, and then we taper down, and then my autoimmune disease flared, so we had to go back up. Like, I've played that roller coaster journey. It's awful. Peter, I'm not going to post that because I don't want to swear, but you said, thank you so much. My doctor is not your favorite, and he wanted me to come down much too fast. Yeah, if that were me, I would be like, I need a second opinion or what? Because there's no reason to come down much too fast with PMR. PMR is a disease where you will be probably taking prednisone for 2 years. That's the average, 2 years. They want to say it's only 1 year, but that's not true. Like, the studies show it's 2 years. And so if your doctor's like, let's get you down, it's like, well, you're just going to make me flare and then I'm going to be on it even longer. Like, there's no race. But if you are having flares and you've been taking prednisone, It's also a great idea to, can you hear my dog? He's barking. Um, it's a great idea to get another medication on board that can help, which is super cool because when I first started talking about PMR, there were no other medications you could use. None. It was either prednisone or you're just suffering and miserable ball in your bed and you can't even lift a cup of water to your mouth. So in that situation, you've been on prednisone, your doctor's trying to taper it. Let's see if there's another medication you could use. So there's new biologic, super expensive medications that are a possibility. There is Actemra and Kevzara. And if you were my parent, or if I was old enough to have PMR, I would want to be on these medications because even though they're expensive, they're biologics, they're injectables, they are, and they are a way to help your body minimize the amount of prednisone over your lifetime. And that is the goal. We want to keep you on the lowest effective dose, whatever that is for you and your inflammation, your disease. In Peter's case, clearly 6.5 isn't enough. You need more to combat the amount of inflammation. It's like as if there's a fire on your hips or on your shoulders, and there's just this little amount of fire under the surface, and we're putting 6.5 of water to put out that fire, but you're seeing these little flames spurt up and you're getting more and more of them. And so you need more water to keep that flame under control so you can have a much less painful life. Okay, I love this question, Radio Nigel. I'm going to show it. Radio Nigel says, does the body recover after PMR treatment? So PMR is an autoimmune disease that usually, like I said, lasts 2 years, can last 5 years in some people. But after you get it into remission, it does usually go away, and you can recover. But what about the side effects of prednisone? That much prednisone, that many years, that many grams, really, at that point you are taking that much for that long. And what it is there are some side effects of prednisone that are permanent, that cause permanent irreversible damage. And I'll tell you what those are. And so if you experience these, that doesn't just go away after your PMR goes into remission, but the PMR can go into remission, right? So first of all, your eyes. So prednisone can increase the pressure inside your eyes, leading to glaucoma. And if the pressure goes so high that it damages your eye, that damage is permanent. Like that can lead to blindness. Then there's cataracts, where there's like the film that's kind of blocking, like the whiteness, blocking your vision. And that damage is also permanent. But in that case, you can just get a cataract lens replacement, but quick surgery. Hopefully in your case, it goes well. In my grandma's case, they totally botched it and like she went blind in her eye. So cross your fingers. It usually goes really well. Just don't be my grandma. She couldn't drive after that. It was super sad. So that's the first permanent irreversible side effect is your eyes, cataracts and glaucoma. The second permanent irreversible side effect is, I'm just going to go down the body, your heart. So prednisone affects your heart, and it can cause progression of cardiovascular disease. It can cause high blood pressure, which is really common. It can cause high cholesterol, and it can cause arrhythmias, heart attacks, strokes, all those progressions, like any of the damage to your cardiovascular system is not reversible. Stopping the prednisone and getting your disease under control does stop that progression, but any of the damage that happened it's there. There's nothing you can do about it at that point. Aside from take the precautions that you need to, if you've had an arrhythmia, continue to take antiarrhythmic medications. If you've had a heart attack, take a statin, take blood beta blocker, take all of those medications the cardiologist prescribes to prevent further complications, right? Like we want to stop the progression of the heart disease. So that was the second permanent irreversible complication of prednisone treatment is your heart. And then third are your bones. So thinning of your bones leading to bone loss, osteoporosis, all of that loss is permanent. You cannot get it back. And as the guidelines say, it is easier to prevent bone loss than it is to treat it because this is not something you can really gain back. The medications that we have today simply stop the progression. They don't replenish what is lost. And so it's best if you're taking precautions while taking prednisone. And what precautions would they be? Well, the doctors, the rheumatologists who prescribe prednisone for PMR and RA and other rheumatic diseases created a guideline because they're so worried about this permanent complication of prednisone called the Glucocorticoid-Induced Osteoporosis Guideline, written by the American College of Rheumatology. And in it, they recommend taking the following precautions. Getting exercise, that's really helpful for PMR as well, to keep your bones strong. Quitting smoking and not drinking alcohol, as both of those can damage your bones as well. And supplementing with calcium and vitamin D. For the calcium, they recommend 1,000 to 1,500 milligrams per day divided. So you'd want to take 500 in the morning and 500 at bedtime. And vitamin D, and they recommend testing for vitamin D. And I'm super excited that I can announce I now have a vitamin D test on my website. Yeah, you can order this yourself if your doctor is like Peter's. I'm not going to say what your doctor is, and may not be the best at following up, checking, making sure that you're safe and the side effects aren't complications. So I have a vitamin D test. If you go to prednisonepharmacist.com and shop now, you can find my vitamin D test. Or another option that is super easy is to get my supplement that helps support you while taking prednisone. Like the doctor said, it's easier to support your body from bone loss than to give it back. And so you want to take calcium and vitamin D in a supplement like this. This is Nutrinize that you can get at nutrinize.com or at this link, which is my website. And it has a morning bottle and a bedtime bottle. It includes that calcium and vitamin D3. And in addition to that, you also need vitamin K2 to keep the calcium going to your bones and not hardening your arteries and worsening heart disease. And then it also has magnesium and other ingredients to help keep strong bones. So it's got it exactly designed for the person taking prednisone. Like me, I originally designed it for myself, but people with PMR who are on prednisone for a long time, the damage to your bones can be extreme. And so taking the precautions that those doctors recommend, you can do it with Nutrinize. You can get it at nutrinize.com. So that the bone support is in both bottles. And the reason I have two bottles is so that you can, multiple reasons. First, so that you can split up that calcium dose. If you don't split up your calcium throughout the day, you just simply won't absorb it. You can only absorb 500 milligrams at a time. So you'd want to take 500 milligrams in the morning with your prednisone pill and 500 milligrams of prednisone in the evening before you go to bed. Then the other reason I have a bedtime bottle is so that you can get restful sleep at night. They did studies in healthy young men who'd never taken prednisone before, and they found that one dose of a similar drug called dexamethasone was enough to completely throw off your sleep-wake cycle and stop people from making melatonin. So there's melatonin in here and magnesium glycinate to help you feel restful and get the restful sleep that you need so that your body can get that inflammation under control and you can recover from whatever you're taking prednisone for. Next, the second most complained about side effect of prednisone is weight gain and moon face and all of those metabolic complications from prednisone. And so I have ingredients in here that help support you while you're taking prednisone. It's got cinnamon cassia bark in here. It's a natural herb that supports healthy blood sugars. It's got berberine, which some called nature's Ozempic, that I feel is like the perfect herb for people on prednisone because it helps support healthy blood sugars, healthy blood pressure, and healthy cholesterol levels. And so there's berberine in here. And finally, my very most favorite ingredient is called chromium picolinate. And chromium picolinate in a study in Israel was shown to reverse diabetes. I'm not claiming that this can reverse diabetes caused by prednisone, but it was studied in people taking prednisone and then it reversed their diabetes. It was amazing. So you can get the exact dose that they used in that study of chromium picolinate in here. And the reason that it works is because your body is peeing out chromium. And when you give back the chromium, it allows the chromium to bind with insulin to allow your blood sugars to remain stable, to allow the glucose that's floating around in your blood to actually go into cells instead of being stuck outside the cells. So if you just go to nutrinize.com, you can get the support you need for your bones, for your sleep, for your metabolism, so that you can feel like yourself again. Thousands of people have taken this and just love how it makes them feel. That the prednisone makes you feel withered and old and like awful. I personally took it and it was a horrible experience. I was in my early 30s and I suddenly felt really old. It just aged me rapidly because it's not only stealing from your bones, it's not only stealing that chromium, but prednisone's also stealing from your muscles. It's causing the muscle in your arms and legs to be withdrawn, depleted, and your body redistributes the fat as moon face and belly weight gain so that you look pregnant, even if you're a male or not of childbearing age. And it was really sad for me when I was taking prednisone because I clearly was of childbearing age and I had just barely had a baby 9 months before and I'd finally lost the baby weight. And then the prednisone came and put it back on. That belly weight gain made me look pregnant again. And I was like, is there another one coming? And like, no, there's not. Prednisone, baby. Ah, okay. So you can get this at nutrinize.com. All right. We have more questions. Amit Roy says, I have taken prednisolone 16 plus 16 milligrams morning and night for 3 days and tapered down to 8 plus 8, 3 days, then 4 plus 4, 3 days, then 4, 3 days only morning. After that, I started having so much anxiety. Oh, I'm so sorry to hear that. Anxiety from prednisone is real and debilitating. Oh, and there's no easy answer here. For some people, working with your doctor, the answer is to stop taking it. But you had it in the tapering process. So it's so hard. That is something you definitely got to address with your doctor. There are medications they can help you have. There's therapy you can help that may help with these side effects. I'm so sorry. Okay. Ooh, this is a great question. Barbara, are there any supplements to take for sleep while tapering pred? Fantastic question. Nutrinizone bedtime helps you with sleep. It's got melatonin in it, 1 milligram per capsule. It's got magnesium glycinate to help you feel restful and calm at night. It's got B vitamins. All of that helps you get restful sleep. So you start out with that dose of melatonin, and if it's not enough, we can add on another kind of melatonin, another brand of melatonin. But this is a good, gentle dose for most people. And I just answered that. You're right. But it was fun. You answered, like, you asked the question that needed asking. Like, what can you do for sleep on prednisone? Yeah, it's tough. And then Amit, one more thing back to your anxiety. Often that is a symptom of nutrient depletion, that you might be low in magnesium, you might be low in B vitamins. So taking something like this, I'm guessing if you're taking prednisolone, you're not in the United States, so you can't buy this, but you can go and look at the supplement facts on the back on my website and find something similar. It's probably going to cost a lot more because I have a whole bunch of really good stuff in here, but that would really support you to give back those nutrients that can lead to anxiety, that when they're depleted, that can cause anxiety as a symptom. Okay. All right. Let's see. What other question? I think I have time for one or two more questions. If you have any more prednisone questions, drop them in the chat. I'd love to answer them. So far today, we've covered rheumatoid arthritis, polymyalgia rheumatica, permanent irreversible side effects. I'm going to review what those are until I find somebody asking a question in the chat. Ooh, we got one. Nigel says, fantastic live chat, really helpful. Thank you from England. You're welcome, Nigel. I love that you came from here from England. It is still, to this day, so amazing to me that I can be a mom in the United States and be talking to somebody in England. And I don't know where Amit is, but on the other side of the world, basically. Like, it is the most miraculous thing. We live in the most amazing time when you can have a live chat with people from all around the world. Like, my grandfather was a pharmacist and his wife was a stay-at-home mom, mother of my daddy. And she, I'm sure, would have been just like me and been able to get a good education and work if she'd been born at a different time. But she was born when the woman stayed home and she didn't get to get a higher education. And so when her husband was the pharmacist, owning the family pharmacy, she supported him in his professional organization. He was the president of the Utah Pharmacists Association. And then later on, she was the president of the Utah Pharmacists Association Auxiliary, which was the bunch of wives who supported their husbands by doing fundraisers and having special events like dinners. And basically it was a wives club that helped their husbands. And that, my beautiful grandmother at that time in her 30s or 40s or whenever she was doing that, I wonder what she would think if she could glimpse this moment, 40, 56, the pharmacy is now 70 years old. So like 50 years later, if she could glimpse this moment when her granddaughter could be a board certified doctor or pharmacist and help people across the world, basically people watching on television. It's truly a miracle to me. It is the most amazing thing. The opportunity we have to interact is truly so beautiful. And I'm grateful that we could have this live chat, Nigel. Okay. All right. So Amit Roy has a clarification. Actually, it was methylprednisolone Predmet, and not only anxiety, it also caused spine issues and balance problem. Oh, goodness. So methylprednisolone in America is called Medrol, for those of you who don't know Predmet. I like the name Predmet, though. I kind of prefer that. Anyway, so anxiety as a side effect is awful. I wonder, tell me more about these spine issues. I haven't heard of that. Like, was it osteoporosis in your spine, like having collapsing vertebrae? Is that what you're talking about? Or is there something else? The balance problem, I'm guessing in your ears, like having not feeling steady, just kind of feeling dizzy and confused. I've heard of that definitely before. Barbara wants to know how to make sure to not miss your next live. Well, there's several ways. You can get on my email list. Let me give you a link to that. prednisonepharmacist.com. So go to my website, prednisonepharmacist.com. at the bottom, there's a little form you can fill out and you can get on my email list. Second, you can subscribe to my YouTube channel. I am way more active on YouTube than on Facebook. So definitely follow me on YouTube. And then I'm hoping to be better at using technology on Facebook. That's coming. I'm going to be better at scheduling these live events on Facebook. But recently, I've just been going live with no announcement at all. For this week in YouTube and on Facebook, I will be going live at the top of this hour, whatever this hour was for you. For me, it was 2 p.m. Whatever time zone you're in, it's 46 minutes later. That's when I'll be going live today, tomorrow, and the next day. So come with questions. I'd love to talk more about your prednisone journey, Barbara, and anyone else. Okay, Amit Roy, how to fully recover from this. Spine issues like disc herniation. Wow, that is way outside my pay grade. I am a pharmacist and not a spine surgeon or I don't even know what kind of doctor, pain doctor. I have no idea how you deal with disc herniation. They don't take pills for that. And pharmacists know all about pills. So I wish I could answer that, but I really have no idea. I'm so sorry that prednisone caused that complication for you. That really makes me sad. Okay. Any more questions? You have 10 seconds to post one in the chat. Otherwise, this episode of Dr. Megan, the Prednisone Pharmacist, live with prednisone warriors from around the world, was sponsored by Nutrinize, which you can get on my website, nutrinize.com. You can get a morning and a bedtime bottle, all for the low price of $78.74. And your entire month supply, you can get all the supplements you need, the entire month. You don't need anything else. This is it. This is all you need for only $78.74. So just go to my website, nutrinize.com, get the support you need while on prednisone. And I don't see any more questions in the chat. So signing off as Dr. Megan, your prednisone pharmacist. Bye, everybody.